Good afternoon. I'm Megan Perkins, and I'm going to be talking about oral hygiene today. Did you know in a lifetime the average person produces over 100,000 gallons of saliva? There are over 700 different types of bacteria in your mouth. That's a lot of germs. Today, I'm going to be talking about why oral hygiene is important, the advancements in the dental field, and how oral hygiene can improve your overall health. A hygienist's role is to educate their patients and show prevention methods. A hygienist will educate you on how to take care of your teeth and gums properly. This is going to help maintain a good oral hygiene and overall better health. Now, how does this improve overall health? Well, did you know people with gum disease are twice as likely to have heart disease than people without gum disease? The Mayo Clinic states, some research suggests that heart disease, clogged arteries, and stroke may be linked to the inflammation of oral germs. This is why, being a hygienist, it is important to educate your patients about correct brushing and flossing techniques. This is how it can improve overall health of a patient. You should see your hygienist twice a year, every 6 months, for a regular cleaning to help remove plaque and tartar from your teeth. At home, you should be brushing twice and flossing once a day. For brushing, you want to brush in the morning and night. For flossing, you want to floss once a day. It doesn't matter the time, as long as you're flossing. It can be morning, night, afternoon, right before bed, whatever makes it easiest for you to maintain good oral hygiene at home. Now that we've talked about how to take care of your teeth, there's a lot of dental products out there, and what should you use? As a hygienist, there are different types of wax. The two main categories are unwaxed and waxed floss. I would recommend wax floss to my patients. The wax floss has wax on it. It's going to make it a stronger floss and make it easier to get in between contacts without breaking. The correct way to floss is to go in between the contact and do a C-shaped motion in between each individual tooth. Now that we talked about floss, what kind of toothbrush is the best toothbrush out there? Well, the debate is manual versus an electric toothbrush. Oral-B states an electric toothbrush is better than a manual toothbrush. I have the Oral-B IO toothbrush, which is the advancement in technology in the dental field. With this toothbrush, it is great because it has a timer on it, it has a pressure sensor, and other settings as well to make your at-home oral care better. With the timer, you should be brushing your teeth for at least 2 minutes. You're going to do 1 minute on the bottom, 1 minute on the top. This, with the timer, is going to make it easier because it takes out the guessing of how long you've been brushing your teeth for. With the pressure sensor, it makes it great because if you're applying too much pressure, it's going to show a red light showing that you are applying too much pressure and you need to lighten up your technique. With a manual toothbrush, if you have flared bristles, it means you're pressing too hard and you are actually causing issues to your gums, which could cause recession, which you don't want. So I would recommend an electric toothbrush for my patients. An electric toothbrush does over 1,000 rotations per minute, while a manual toothbrush only does about 100 rotations per minute. So you're going to get an overall better clean with an electric toothbrush. That's why Oral-B recommends one. Now that we've talked about Oral-B IO, the toothbrush, and how its advanced technology has improved the dental field, let's talk about the future of the dental field as well and other techniques out there. We have 3D scanners, 3D printers, and digital x-rays. The 3D scanner is going to help improve the hygiene field because patients don't need to take those impressions anymore. No goopy mess, no metal trays in your mouth, just a camera to show and scan your mouth that's going to show up on the monitor. The 3D scanner is great because it's going to take out the anxiety for the patient and make it easier for the patient to understand exactly what is happening inside their mouth. The 3D scanner can show you exactly where you need to brush better, where you have inflammation in your gums, or if you do need treatment like you have a cavity. Makes it easier for the patient to understand and show them where they need to brush better to improve oral health. With all these advancements, this is why I feel comfortable in the dental office and how I can make my patients have a better experience to help improve their oral health and their overall health as well. I'm excited for the future of working in a dental office and how I can improve my patients' care and bring better treatment to them. Thank you.